Well, towards the end of my tenure at AIIMS, where I was doing my senior residency, I decided to open my own center. After spending 12 years in AIIMS, I wanted to give the same level of clinical excellence in a convenient and affordable manner to the patients. So that is when I joined with another colleague of mine and we started our center to provide the patients a good quality, honest eye care services. So we got a very good response when we started our practice. We got very good response from our patients and colleagues both because we were fulfilling the unmet need because there was a need of good vitreoretina center in the city. Initially, we started with the main focus on retina and vitreous surgeries along with cataract and refractive. And later on, we expanded our team to add more consultants and we covered all the subspecialties of the eyes. So the journey so far has been great. And as of today, we have a team of more than 15 doctors who are coming to our centers for doing the OPDs and the surgeries, and many more doctors who are coming to utilize our surgical facilities. And the number of patients and satisfied patients have grown in the last 20 years. It has been quite good. Well, the biggest challenge that we had was to get the like-minded people who are good, competent and honest and who work as a team with you. And I actually have been very lucky in that regard. We got a very good team of people. We always focused on getting the best of the people in their own subspecialties. Along with that, we're looking for people who are honest about their work and the ones who are having a good team spirit. And today I'm very lucky to have a great team of doctors who are not only the best in their fields, they are honest, they value our 4 values that we care for in our center, and we've got a good team spirit amongst ourselves. Well, COVID came as a shock for all of us, everyone, and especially it affected the healthcare workers the maximum. And moreover, being the administrator, I had a challenge not only to save myself, I have to take care of the safety of my patients and their attendants, my staff, and also to take care that we follow all the new guidelines that were being made by the government from time to time, and it was a difficult and challenging time. But we ensured that our safety protocols were up to the mark. I took help from my colleagues in Singapore and USA. I took their feedbacks, devised our own setups for the safety, and our protocols are copied by many other of my colleagues as well. And we are proud to say that we could take care of the whole COVID time. We could see our patients, take care of their emergency services without any of our staff falling sick or without any of the patients falling sick. Having said that, this was the time when we got a lot of free time when we could improve our systems, and we used this as an opportunity and we made our system stronger, especially my EMR or the electronic medical record system. We made sure that we add on more and more patient-friendly initiatives like teleconsultation, patients doing the booking right from their home, giving the feedback and accessing their data from their home itself. So their waiting time in the hospital is minimized because of this thing. So it actually was a blessing in disguise for me to improve my systems, and many doctors have joined my team after COVID because they could find a value in this place where we are doing things in a safe manner and in a very methodical manner. At Synergy Eye Care, we believe in the philosophy of providing the same level of treatment to everyone irrespective of their paying capacity. So we have systems where if there's a poor patient, we'll give them a discount or whatever help that we can, even up to the level of doing free surgeries for them. We can also do some free camps, and we also are enrolled with the Ayushman Bharat scheme where the people from poorer society can come take use of our facilities. In fact, this is an open instruction to each and every doctor visiting us that if you have a poor patient, please bring them to us. We will take care of them at the lowest possible prices or even free to the real deserving ones. So we don't want to let any patient suffer because of lack of resources. Of course, if they don't have some facilities, we would refer them to our colleagues or maybe refer them to AIIMS. And I'll talk to my friends out there to make sure they get the best possible treatment. Yeah, so whenever you have a team of doctors working together or any team working together, we have to make sure that they align to the same vision, they value the same principles, and they work together with the same ideas. So we at Synergy work at 4 main pillars: competence, integrity, safety, and compassion. So for each and every doctor who is joining us, we make sure that they are the best in their field, in the competence. And not only the doctors, even the paramedical and the non-medical staff is also trained to the highest order. And we make sure that they are trained on a regular basis so that they are up to date with the latest that is going on. When it comes to integrity, there is no compromise whatsoever. Every patient is treated with the best interest of the patient in mind. We want to make sure that they get the honest and the true opinion from us. Safety is very, very important. We want to have a safe environment not only for the patients but for their attendants, our staff and the doctors. We were one of the first centers in Delhi to get NABH accreditation, and we are stickler for the safety norms and we follow it to the hilt. And last but not the least is compassion. The patient who is coming to us is already under a lot of distress, especially when they're coming for more complicated eye diseases. We ensure that with our compassionate behavior, the patient is made to feel at ease and his suffering is minimized and is taken care in a proper compassionate manner.